I wanted to look at the data set coming on your screen very carefully. This compares the number of deaths reported in the second wave of the COVID crisis with what happened during the first wave. And if you were to look at the numbers, you'll realize that the number of deaths happening in the second wave is substantially higher than the number of deaths the first time round, which raises the big question: how long will this wave of the coronavirus go on for? You have it there on your screen. More than 50,000 deaths reported in the second wave of the coronavirus already. The red line denotes what's happened during the second wave. The yellow line at the bottom reflects mortality in the first wave. Huge gap between the two. How long will it stay this way? Now remember, you first report cases, and about 21 days after that, you see the cases register and a certain increase in deaths. So on the show this evening, I will try and understand as best as possible that one question which I'm sure is uppermost in your mind: when will this nightmare end? But before that, our lead story tonight.
The second wave of coronavirus has got a vice-like grip on India. The virus has become more contagious and is spreading like wildfire across the country. The one question we're all asking is, when will this end? When will we see the peak of the current wave, which then will be followed by a decline in cases?
I think we're already seeing that the peak has happened as far as the western part of India is concerned, with cases now stabilizing or declining in Maharashtra. Hopefully in the central part of India, that is in Delhi, Punjab and the surrounding states, in the next few days, hopefully in the next 2 weeks, it will stabilize and cases will start coming down.
Experts opine the exact date may be difficult to predict, as different states will reach their peak at different times.
If we talk of the second wave, like we saw in the first wave, there will be different parts of the country which will peak at different times.
Those predicting the trajectory of cases say a nationwide peak is expected by the 7th of May, and that there are chances of states peaking differently. That would explain a delay in decline in cases in those states.
The pandemic basically started in the state of Maharashtra. So Maharashtra is already in a decline. You will see that. Now other states started peaking a little bit later because the pandemic traveled across the country. So they will peak perhaps not next week, but the week after that. And a few states are still showing climbing up. So they will peak later still.
But that's not all. Top medical experts say even after the second wave, India will not have the liberty to be lax, and a third wave may be on its way. Well, the government is saying that it appears that western Indian states of Maharashtra have peaked already. Cases are now on the decline. But states in eastern India like Assam, Odisha and Bengal will likely peak in the next few days. Well, even if the peak is over and cases start to decline overall in the country, which is expected, is what Dr. Guleria says, there is a possibility of a third wave, going by the nature of how a virus essentially behaves. And we have to be prepared for the third wave. In New Delhi, Sneha Mordani for India Today.
So there are very critical questions that need to be established. Talk of the third wave peak, when does it end? There's a lot of talk of the third wave. What form and shape can it take? How do we ensure it is as small as possible? Joining me for insights which will help shape our understanding about what to expect over the next few weeks and days, I have Professor M. Vidyasagar. He is an IIT professor and also importantly head of the National COVID-19 Supermodel Committee. So they're the ones in government looking at their projections of where they believe the COVID graph is heading. We have Dr. Shahid Jamil, well-known virologist, CEO of the DBT Wellcome Trust of India. I have also Gautam Menon. He's a researcher in modeling of infectious diseases, professor of biology and physics at Ashoka University. And I, last but not least, have Dr. Ashish Jha. He's the Dean of the Brown University School of Public Health. I want to go across first and foremost to the representative from the IIT, Professor M. Vidyasagar, who's part of the government's COVID modeling efforts. And I want to walk across to the Corona India dashboard, and I want to show our viewers trajectories. What you can see in this blue line represents Maharashtra, where we're seeing a tapering off and the graph for COVID cases beginning to come down. This lighter green line is Karnataka's hockey stick-like incline. In the other green line, which is Kerala, we can see an increase. Andhra Pradesh is now showing an increase. Uttar Pradesh is showing a bit of a dip. So, Professor Vidyasagar, welcome. Can you begin by explaining the answer, in your view, to that one question which everyone has in their mind: when will we hit the peak of the second wave of the coronavirus?
Well, if you take the nation as a whole, our prediction is that we will see the end of the uptick and we will see a decline coming by the end of the present week. So that is to say about May 7th is the end of this week. So the cases should start declining. But as you have pointed out in the intro, different states are going to peak at different times. So I totally agree with your observation that Maharashtra is well on the way to decline, while other states are going to be climbing. But nationwide, definitely the cumulative total, which is what everybody may be watching, is at the peak now or very, very close to it.
That's very important information you're sharing with our viewers, and that will come as huge relief to everyone who's listening. You are telling us, as the head of the government's modeling committee, that you believe that the national peak of the second wave will be by the end of this current week. Is that correct, Professor?
That's what I'm saying. I'm putting my neck on the chopping block. I know that, but that's exactly what I'm saying. That if you take the total number of cases in our country and with a trailing 7-day average, because as you know, the daily numbers keep fluctuating. So you should not just look at the raw numbers. You look at a weekly average. That number will decline. Will peak and begin to decline by the end of the present week. Yes.
Let's go state by state. I'm concerned about Karnataka, Kerala, Andhra Pradesh, Tamil Nadu. Uttar Pradesh is showing a bit of a dip. Do you believe that, or do you believe the case load is coming down because, not in reality, but because testing is coming down? And Maharashtra, you're saying, is dipping. So you're saying nationally the peak is end of this week. Try and now break it down state by state. Which states do you think will start peaking soon? Where do you think the peak will be more drawn out?
So I don't really want to go through a roster of states. So I will try to make it easy for your viewers. The second wave basically started in Maharashtra. So you just look at the map of India and look at the distance from Maharashtra. The farthest state is from Maharashtra. The more slow will be its peaking and the more slow will be its decline. So the immediately proximal states will be the ones that will be peaking a little bit out from Maharashtra and decreasing a little bit later. And the much farther off states, you mentioned Assam, for example, they will take a little bit of time. There will be a 2-3 week gap for the pandemic to travel across the country. And that delay will be seen both in the rise and the fall. But different states will have different trajectories, obviously.
When will the last state in the second COVID wave peak, according to you? So which states will peak last, and around when do you see that happen? Will it end in May, or do you think it can extend?
Are you talking about the peak in each state?
Yeah, peak in states which will peak later. Which states will those be, and when will they peak, and by when will it start coming down? So between the peak and the end of the wave, how much time do you typically see?
No, that's a good question. So what I would like to recommend to your viewers is to follow the Twitter timeline of Professor Manindra Agarwal of IIT Kanpur, who is another member of our modeling team. He gives daily updates of the projection practically for every state, though not for every single state. So let me answer your second question, which I think is perhaps of more interest. You are asking, if I understood correctly, whether at the end of the month, that is the end of the month of May, there will still be some states that would not have peaked. Is that your question?
That's part of my question, yes.
Yeah, no, we don't anticipate that. Because we're expecting the all India totals to peak by the end of the present week. Maximum by under 10-15 days, we expect every Indian state to have peaked and to begin a downturn. There may be one or two outliers because we have 30 states in India, but by and large, that is what we expect.
How long, according to you, between the peak and the end of the wave?
So that's easy to explain if you look at the curve of the first wave and the curve of the second wave. If you go back to the first wave, the rise was very gentle. It took about 3.5 months to reach the peak, and the drop was equally gentle. It took about 3.5 months to come down from about 1 lakh new cases per day to 10,000. So in the present case, if you look at, for example, April 1st, we had 85,000 cases. And exactly 1 month later, we pierced the 4 lakh barrier. So we expect that the decline will be more or less equally rapid. And we expect that the nationwide caseload at the end of May should be something of the order of 1.2 lakhs.
When do you see the second wave end?
Well, how do you define ending? You mean 0 cases? That is not going to happen. We need to accept that.
Okay. What's your projection of the third wave? When do you see the third wave come? What form are you projecting the third wave to take? Because by then vaccination would have picked up some speed as well, Professor?
Yes. So the question we should ask ourselves is, what could possibly precipitate a third wave, right? So there are several factors. One, of course, is that the present second wave would have seen a fairly large number of people getting infected. We measure only the ones who test positive, but there are also untested people who are asymptomatically infected. So these people are all going to be immune for a period of time of, say, 6 months, something of that order. So they will begin to lose those immunities at the end of that period. So that is when we need to have our vaccination program well underway, so that even as they begin to lose their immunities, they will not be susceptible to catch the catch the virus, I should say. So if we do these things, that is, vaccinate a substantial part of the at-risk population in about 6 months, then the so-called third wave might wind up being a third bump rather than this horrific wave that we have seen as the second wave.
So you're projecting the third wave to be 6 months away, but can I just ask you, did your supermodel committee predict the second wave to be of the kind that we're witnessing? Did you actually foresee this is hardly a wave, this is a tsunami? You know, your comments will have greater credibility if you actually foresaw that, which means that your modeling is strong and solid and that your projections are credible, sir.
Right, that's a perfectly valid query. So what we foresaw was the timing of the peak of the second wave. We pretty much got that spot on target. What we did not get at all on target was the height of the second peak.
What was your projection, sir? What was your projection of the height of the second wave?
Yes, we thought that the second wave would peak out maybe around 1.2 lakhs.
So you underestimated by a factor of about 3, because currently it's about 4 lakhs or so. So more than, it's a huge underestimation. How do I know that your estimate about when the peak will hit is also not an underestimate?
Well, whether the peak is an underestimate or not, you can just check by looking at the daily case statistics, right? So if the cases begin to turn down in the next few days, then you know that our estimate is correct.
But you know what you're saying is true if testing is constantly increasing and testing is honest. But if states start artificially deflating the level of testing, then it may seem as if the caseload is coming down in your supermodel, but not in reality. Is that a concern you have, Professor?
Well, it is a valid concern that a journalist like you would have, because it's your job to look behind the numbers and dig out the hidden story, so to speak. But as a modeler, you cannot start second guessing the available data and start fudging them just to suit your own guesses as to what you think is happening. The best you can do, of course, is to try to replicate the available data. And the idea is that if we are faithfully replicating the reported numbers, the unreported numbers, if any, would follow a similar trajectory.
I
Because
appreciate.
otherwise, what you're doing is superimposing your own prejudices on the data, which is not a good idea.
I deeply appreciate your time and your insights. We've heard from the head of the government supermodel committee. I want to go for an international perspective to Dr. Ashish Jha. He's one of the world's top infectious diseases experts. You've just heard, Professor Jha, from the head of the Indian supermodeling committee. I was keen that you listen to him before I go to you, because I now want your perspective on what you're hearing from the Indian government's committee. Essentially, the IIT professor saying that the peak is going to hit India a few days from now, by about the end of this week, by about the 7th of May. On the basis of all the evidence that you have at hand and what you're studying from India, do you think this to be a probable scenario?
Yeah, so thank you for having me back. I think it is entirely possible that we could be peaking now, or will be peaking very, very soon. But as the professor laid out, it will vary from state to state. I do think all the data that I'm looking at suggests that Maharashtra has really turned the corner. But it's going to be a while before, let's say, West Bengal and places further away are going to be peaking. So I think the month of May, you may see a peak, but then a very, very slow decline because so many states are peaking during the whole month of May. I think we're going to get into June with very high numbers of infections. Maybe the one place I would disagree is this idea that the case numbers will drop as quickly as they rose. That depends completely on how effective policy is. If policy is very, very effective at bringing infections under control, then yes, case numbers will decline quickly. If it is not, the experience of many countries is that sometimes you peak and then you slowly meander down over many months. So that will really depend on how things go. I am not so confident that we will see a dramatic decline in cases. Obviously, I hope we do. But we may be at a peak, but we may end up being at a very high peak for a long period of time.
In your best estimate, how much of a period do you foresee between the peak of the second wave and the end of the second wave, Professor?
Yeah, it could. Again, that is the big question, Rahul, and that is going to be dependent on what we do. This is not the peak, and how quickly it comes down is not just a feature of the virus. It is completely a feature of how well we're doing on testing, how well we're doing on vaccinations, how well we're doing on preventing further spread. My take is it's going to be obviously at least through the month of May, probably through a large chunk of June, and I would be surprised if we don't end up getting into July with still a reasonable number of infections, many thousands, tens of thousands a day by the time we are into July. But my hope, of course, would be that sometime in June we can get underneath the 1 lakh number per day and continue coming down.
Professor Brahma Mukherjee at the University of Michigan Department of Biostatistics estimates that India is underestimating the caseload by a factor of 16. She's correlating actual case study data with the sero surveillance studies that have been done. And we know for a fact that deaths are being underreported, cases are being underreported because so many instances we anecdotally know of where there isn't enough testing taking place. How does imperfect data impact the projections of the government and your estimates in your view, sir?
Yeah, it's a very good question. So I agree with her that there is a dramatic undercounting both of cases and deaths. It's hard to know exactly how much. My best effort to correlate it suggests that the true number of infections is probably 5 to 10 times as much. So if we have 4 lakh cases, the true number is 5 to 10 times. You can do the math. It's much higher, and probably a similar number for deaths, underestimating deaths by a very large amount. This really does pose all sorts of challenges for any estimates that we do. My hope is that we can continue improving testing, which is probably the best thing we can do to get more reliable estimates. And if testing can ramp up further, we can do a better job capturing infections and capturing people who are dying of COVID. It will improve the models But I think we just have to be in for a period of uncertainty over the next month or two because of all the data that we're missing.
You said what happens from here depends on our policy choices. What are the wrong policy choices in your view? What are the policy choices that India could pick which could help ensure that we're able to contain the second wave as best as possible?
Yeah, you know, we're more than a year into this pandemic. We know a lot about how this virus spreads, and we know a lot about how to control it. So we know that the key features of pandemic control, the public health features, are, of course, number one, no crowds, no large crowds gathering indoors or out. Second is really shutting down any level of indoor gatherings, and that means restaurants, retail shops, anything where people gather indoors is a problem. Third is making sure we have universal mask wearing, that everybody really needs to be wearing a mask when they're out and about, and especially if they go into indoor space. And then the fourth is ramped up testing. The more testing you can do, the earlier you can do it in the disease course, the more you find people before they've spread. That's the cornerstone of that. And of course, vaccinations. But vaccinations are not going to help in the short run. They're going to help in the medium to long run, and we absolutely need to be doing that. If India does all of those things in a very, very serious way, then absolutely India can get this under control, can bring infection numbers down, and move beyond the second wave.
Are you advocating at this time, Professor, a national lockdown? We've heard from Dr. Anthony Fauci in the United States. We have heard from the director of AIIMS suggesting that there be a national lockdown, that there is no alternative. As one of the world's top infectious diseases experts, do you think India needs a lockdown at this moment?
Well, so it depends a little bit on how you define lockdown. What I described were no indoor gatherings, no large outdoor gatherings is in many ways a lockdown, but it's not the kind of lockdown we had last April where everybody was sort of shut down. I think you can allow for some amount of outdoor activity. Outdoors is relatively safe. So I don't know that I would advocate for the kind of lockdown we had last year. We've learned a lot about this virus. But if you get to the specifics, my sense is Dr. Fauci and I are probably very, very close in our recommendations. Anything that creates indoor activity, retail, schools, etc., very dangerous right now and not the time to be, and workplaces, not the time to be doing it.
What's your sense about the possible third wave? There is a fear that the third, like this wave, is impacting younger people more, that the third wave could impact children. Is that just an apprehension? Is that a fear backed by research and science?
So first of all, whether there is a third wave or not in India is completely up to India, right? Again, the second wave was completely preventable if we had had better policies. They weren't implemented, and we now find ourselves in this horrible second wave. There is nothing inevitable about a third wave, and that can be prevented. There's no reason to think that it will disproportionately affect children. I think that is fear. What happens after this wave is over and how quickly this wave is over is all up to us. It is not, should not be seen as something external that India cannot control. Lots of countries have done a good job managing and preventing these waves. India certainly has more than enough capability of doing it.
Stay with me for a moment. I want to get in a perspective from Gautam Menon and Professor Shahid Jamil. You're hearing from Dr. Ashish Jha at Brown University. He anticipates that it is possible, like the government supermodel committee expert said, that we may be hitting the peaks very soon. You're here in India, closer to the data, closer to the ground. You're seeing, sir, what's happening around you. Do you buy what the government expert just told us, that the peak could be just around the corner, which is great news? It just means that the beginning of the end of this nightmare would then start.
I think around most models would suggest around the middle of May, with a substantial uncertainty on that. My worry really is that with the level of testing that we have, we won't really know. There are lots of cases that are going untested. There are states where the numbers are really, where you know that people are ill, but they're just not being able to get tested. There are too many delays between requiring a test and getting a test. So what that peak is may not be very clear. The peak may occur somewhere else, but the peak in the numbers may come earlier. But I would agree broadly that around the middle of May is when we might expect to see some turnaround in those numbers.
So you're being diplomatic, but if I were to frame what you're saying in the way that I understood, you're saying rather than the 7th of May, which is the first week of May, you anticipate that the peak is more likely in the second week of May, which is towards the end of next week. That's specifically what you're saying, Gautam Menon?
Yes, I'd put a broader band on it, somewhere probably between the first week and the third week. Roughly the middle of that would be the middle of May. Yeah.
And you're concerned about India not testing enough and that actual numbers being higher than reported numbers. How could that impact the second wave in your view, sir?
So test positivities in India are around 20%, which is quite high. And we know from reports from rural parts of, for example, Uttar Pradesh and other states, that there are many people who are unable to get tested because test kits are not available, or there's too much of a lag between people requiring a test and getting a test. So this can mess with the numbers. If those people test positive, they will test positive a week later than they should have if they were being tested on a regular basis. So there may not be much value in deciding an exact time when you expect a turnaround because these very large uncertainties exist in the data.
Dr. Shahid Jamil, how much of an X factor are new variants in what we are seeing? So we've heard from Ashish Jha, we've heard from Gautam Menon, they're anticipating that the second wave will peak somewhere in the middle of May. Now, our new variants, we saw a report from one of our correspondents in Hyderabad today that there is a new variant in Andhra Pradesh which doctors there are concerned about. It's apparently 15 times more infectious. It's very limited in its spread at this moment. But that's a variant that they're looking at. Now, how much of an X factor are new unknown at this moment variants to these calculations?
Well, we do know that the two variants that are most widespread in the country, that's the B117, which is the UK variant, and the B1617, which is the Indian variant. Both are more infectious than the parent virus. So yes, they are spreading faster. But it really boils down to whether, for the production of a model for prediction, Gautam and Vidyasagar ji and others are more competent at this. You really need good data. And Rahul, I've said this on your show earlier, and I'll repeat it again for people who may have forgotten this, that all models are wrong, but some models are useful. It really depends on the data that goes into making a model. If you're not testing enough, if you're not reporting the daily cases properly, if you're not reporting daily deaths properly, it's very difficult to make an accurate model and say, okay, the peak is going to be this coming Friday. That's just not possible. So all models depend on the assumptions you make and, the data that goes into it. Death is something that is very, very difficult to hide. And if you simply look at death data, India's natural death rate is 7.2 deaths per 1,000 people per year. That translates to roughly 27 to 28,000 deaths per day. This is natural deaths. This is the baseline. Now, if only 3,000 people were dying of COVID every day, that would barely add about 12% to the baseline. You would hardly notice it in crematoria and burial grounds. On the ground, you don't see that happening. You see people lining up at crematoria. So what does that tell you? That tells you that deaths are being hugely undercounted, possibly by a factor of 10. And if deaths are undercounted, so are cases. So, unless good numbers go into models, you're not going to be having good models of the type that you want. And I do agree with Dr. Jha that the downward curve is likely to be more extended. I don't think it's going to be really a very sharp decline. It's unlikely. It's going to be more protracted, longer term, because remember, any model does not take into consideration the behavior of the population. Our behavior, human behavior, is very difficult to predict. So all that will come into play. Coming back to your question about variants, we really know that there are two dominant variants. Don't worry about the recent report saying, this variant in Andhra is 1,000 times more infectious, all that. Those are simply laboratory petri dish experiments. Laboratory petri dish experiments, just because a cell culture is producing 1,000 times more virus doesn't mean that that virus is 10,000 times more infectious in a population. Let's just focus on these two variants. And we pretty much by now know that these variants are more infectious. How infectious, we don't know. Possibly 50 to 70% more infectious. Percent, not times. So, you know, if it was to spread, you know, if it were to double, it will not double, but it'll go, you know, 70% higher than that. So I think the numbers will increase, but it's not going to increase just because these mutants are there. And I've been saying earlier also that don't worry about this mutant or that mutant. Every mutant can be controlled by a good mask. So let's not worry about those things too much. Let's modify individual behavior. Let's continue to wear masks. And really, as Dr. Jha was saying, shut down for all indoor activity, all large outdoor activity, as we have seen in the past. That's going to get things under control.
Dr. Jha, what are the risks this Indian variant poses to the global fight against the pandemic? We know in the United States and in several countries of Europe, restrictions are now being withdrawn. People are beginning to go out. But there is a concern about this Indian variant coming and doing what the UK variant did in India. How much of a concern is that in reality, or do you believe now that large parts of the population are vaccinated, that isn't as much of a concern as it was earlier?
Yeah, it's a very good question, Rahul. I'd say a few things. First of all, it's a reminder that we all live in one world, one global community. And so a variant that arises from the Kent in the UK can wreak havoc on India, and variants that arise in India can affect the United States. Even if America, a large part, is vaccinated, we're going to have a lot of unvaccinated people still, and they're going to be susceptible and at risk. And of course, as large outbreaks continue, there will be more variants. We have to pay very, very close attention. That means more genomic sequencing, very close monitoring. But ultimately, the big message is no one country can get out of this pandemic on its own, that we have to have a global strategy. Excuse me, we have to have a global strategy for vaccinating the whole world. That is what's going to get us out of this pandemic. And as long as every country only thinks about themselves, it's going to be very, very challenging. And this outbreak is reminding us of that.
What is the level at which you believe India will hit herd immunity? At this time, there are questions in the US and UK elsewhere about whether herd immunity in the way it was imagined last year holds at all, given that there are new viruses and those viruses could skip whatever immunity you've built, that they could just circumvent whatever antibodies have been created by the vaccine. How does India need to go about this vaccination process to be able to ensure that between now and the third wave, enough people have been vaccinated so that the third wave is a bump and not a tsunami?
Yeah, I will tell you, the honest answer here is no one knows. I will tell you what the experience of countries that have done a good job vaccinating has been. We have seen in Israel, we have seen in the United Kingdom, and we're seeing in the United States, that when you get about 50% of the population vaccinated, 50% of the population vaccinated, that's when you tend to see a sharp decline in cases because of that immunity. How much natural immunity is underlying it, how durable it is, I think all of that is up for debate. But it says India has vaccinated about 10% of its population. It needs to vaccinate probably another 40+% of its population. You know, that's 500 million people before I think India can feel confident that it has enough immunity built up to really prevent large outbreaks and to bring case numbers down. It's a long way to go, and there's a lot of work to be done here. And none of us know if that's even herd immunity, but that is a level that the other countries have experienced is when you really start seeing a big effect.
Thanks, Dr. Ashish Jha. Appreciate you joining us. Much value your time. Thank you. Gautam Menon, what do we need to do to our vaccination mechanics to ensure that between now and a potential third wave, we've been able to vaccinate as many people as possible? Vaccinating 500 million people, given supply and production constraints, will take time, several months. So therefore, do you think we're on the right vaccination strategy? How would you want to tweak it to ensure that we can bring the caseload down and use our limited supplies to vaccinate for maximum effect?
So certainly the constraint now is vaccine supply, nothing else. And we should be really vaccinating around 10 to 15 million people a day, whereas we're at about 2 to 3 million at the moment. And so the first thing to do is to solve that particular constraint in whichever way we can. The second thing, of course, is to go back to a situation where you prioritize the most requiring or the most needy of the population, which are those above 60 and those with pre-existing conditions. Unless you do that, there will always be an impact in terms of mortality. And I think, again, we should go back to basics on this, go back to ensuring that that fraction of the population is well covered before we go to those younger than 45.
Okay. Shahid Jamil, do you want to answer the same question? How do you see the manner in which we're vaccinating at present? Are there any specific tweaks that you have in mind which will help us ensure that we're able to get more buck for every vaccine, more bang for every vaccine?
Yeah, so I do agree with what Gautam said, that I would possibly place the number a little lower. Somewhere around 7.5 to 8 million people have to be vaccinated every day for us to be able to vaccinate everyone we want within this year. Yes, of course, if we want to vaccinate that many over the next 3 months, then the numbers have to increase. But the real constraint is the supply. And from all indications, the supply will not really be up to the mark until maybe sometime late in June, possibly mid of July. India has so far vaccinated at a rate of roughly 2.5 million per day. In the best of days, we have done about 4 million. So that's the scale. Now we have to really scale up, 2.5 to 3 times. Supply will be a challenge, but more than as much as supply, we also have to increase vaccination points. If every vaccination site is able to deliver 100 doses a day, you need somewhere around 75,000 vaccine delivery points. Right now, at the best of times, we have somewhere in the range of 55 to 60,000 vaccination points. Every vaccination point will need people who will, inject the vaccine. So people are needed. So it's really quite a big logistics exercise. And one last thing I would say is that India is a very complex country in terms of its logistics. And therefore, any solutions have to be simple. If your solutions are equally complex, then the complexity, multiplies. It doesn't add up. The current pricing structure is really very complicated. With 50% going to center, 50% going to states and private players, and suddenly, states in India have never really purchased vaccines. Vaccine purchase is always done by the center. So states have no understanding of negotiating. And suddenly you've thrown states in the deep end of the pond and want them to compete with private players for pricing and for supplies. That complicates the whole issue quite a bit.
Okay.
And I think that is going to impact our vaccination program.
So we've had a very insightful, high-quality conversation, and I want to thank Gautam Menon, Dr. Shahid Jamil, also Ashish Jha, and the expert from the Government Supermodel Committee, the professor from IIT, for joining us and sharing your thoughts about the manner in which the vaccine process is being rolled out and when we'll hit the wave. Professor Vidyasagar, thank you so much for joining us. Thank you, gentlemen. What I want